How to find health insurance for pre-existing conditions in Asia. Imagine moving to Asia and needing health coverage that understands your medical history. Finding the right insurance can seem tricky, but it's definitely doable. Let's walk through how to find health insurance that covers pre-existing conditions while living abroad. First, honesty is key. Always give complete and accurate details about your health history when applying. If you hide or omit information, your claims could be rejected later or your policy canceled. Being truthful helps you get the best possible coverage. Next, check if your employer or expatriate organization offers group insurance plans. These plans often include coverage for pre-existing conditions and have better terms than buying individual policies. If your company has a plan, it's usually the easiest route to comprehensive coverage. If you need an individual policy, be aware that some insurers exclude pre-existing conditions entirely. Others might impose a waiting period, known as a moratorium, during which treatment for your condition isn't covered. Some policies do cover pre-existing conditions but charge higher premiums, sometimes double or triple the normal rate. There could also be limits on how much the insurance pays for ongoing treatment. Most international insurers perform medical underwriting. They review your health history, including diagnoses, treatments, and medications, to decide what's covered and at what cost. This process varies by insurer and your specific health issues, so it's important to compare options carefully. Travel insurance usually doesn't cover pre-existing conditions unless you buy a special plan. These plans often only cover sudden emergencies, not ongoing care. For long-term stays or residency, international health insurance plans are better suited because they provide more comprehensive coverage. Working with a broker who specializes in expatriate health insurance can be very helpful. They know multiple providers and can find policies that fit your health needs and budget. Be prepared to provide documents like medical records, diagnosis details, and treatment history to speed up the underwriting process. Insurers look at a period called the look-back period, which can be from 6 months up to 3 years before your application date. If you had treatment or diagnoses during this time, those conditions are usually considered pre-existing. Knowing this helps you understand what might be excluded from coverage. Cost is an important factor. Coverage for pre-existing conditions tends to be more expensive, especially in countries with high healthcare costs like Singapore or Japan. Premiums can vary widely depending on the country and insurer, so compare quotes carefully. Many Asian countries have excellent private healthcare facilities, but public healthcare often doesn't fully cover expatriates. That's why private international health insurance is essential, especially if you have ongoing health needs or complex conditions. To find the best coverage, research providers offering international plans that include pre-existing condition coverage. Check if you qualify for group insurance through your employer or expatriate community. Get quotes from multiple companies and compare their terms, especially looking at exclusions, waiting periods, and premiums. Long-term planning is important. Think about your future healthcare needs, including access to specialists and hospitals in your new country. Keep your medical records organized and ready to share with insurers during the application process. In summary, Americans living in Asia with pre-existing conditions should focus on group insurance if available, work with experienced brokers, and carefully review individual policies. While coverage might be costly or limited, thorough research and professional help can lead you to a plan that supports your health and peace of mind abroad.